Let's talk about a few things in men's health that are, super common, but we just don't really talk about them enough. Today, we're going to demystify the signals your body might be sending you about erectile dysfunction, prostate health, and even hair loss.
All right, so let's just jump right in with a question. You think about these three different things: ED, problems with the prostate, losing your hair. What's the one thing that connects them all?
No, it's not a trick question. The answer is actually pretty simple. They are all incredibly common. I mean, millions and millions of men deal with them. And that's exactly why we've got to talk about them, get it all out in the open. Just understanding what's going on is the first real step to feeling like you're in control.
So let's get started by doing just that, breaking the silence. And the first step is really about changing how we frame these signals that our bodies are sending us. This right here is a really crucial mindset shift. These conditions, they aren't some kind of personal failure. Think of them more like data points. They're messages. Your body is literally trying to tell you something important. So the only real question is, are you listening? Okay, our first signal is erectile dysfunction, or ED. And yeah, we've all heard the term, but what it truly signifies about a man's overall health, that often gets completely missed.
So what's the official definition of ED? Well, clinically, it's the consistent inability to get or keep an erection. But let's be real. Beyond the mechanics, this has a huge impact on quality of life, on confidence, on your emotional well-being. It's a big deal, this phrase.
This is maybe the single most important thing to know about ED. It's a canary in a coal mine. What that means is that ED often isn't the root problem itself. It's more like an early warning flare from your body that something else might be going on, especially with your heart and circulation.
To really get why things might go wrong, it helps to see how they're supposed to go right. And at its core, an erection is just a simple hydraulic event. It's all about blood flow. More blood rushes in, and at the exact same time, less blood is allowed to flow out. When that balance is working, it's an incredibly effective system.
And this is exactly why that canary in the coal mine idea is so spot on. Just look at this list of causes. We're talking vascular issues, nerve problems, hormones. These aren't just related to sexual health. These are the exact same risk factors for huge things like heart disease, diabetes, and stroke. See, it's all connected. Now, the really good news is that for pretty much all of these causes, there are effective treatments. But here's the wild part. Stats show that guys often wait 1, 2, even 3 years before they even bring it up with a doctor. Knowing that real solutions exist should make that conversation way easier to start.
The main medications are a class of drugs called PDE5 inhibitors, and they all work by helping improve that blood flow. But look, they are not all the same. Tmax here, think of that as how fast it kicks in, and half-life is basically how long it lasts. So you've got faster-acting options like sildenafil, but then you've got tadalafil, which sticks around for much longer. The right choice really just depends on you and your lifestyle.
Okay, next up, let's decode the signals from another key player in men's health, the prostate. It's only about the size of a walnut, which is crazy when you think about the huge role it plays in both the urinary and reproductive systems.
Now, there are two common issues here that are really easy to get confused. On one side, you've got prostatitis. Think of that as inflammation, a lot of times from an infection, and it can happen to younger guys. On the other side, you've got benign prostatic hyperplasia, or BPH. That's a non-cancerous enlargement of the prostate, and it's a super normal part of getting older for a lot of men.
And for BPH, here's the thing. Medication isn't always the first move. Simple changes in your lifestyle can be surprisingly effective. I'm talking about things like cutting back on drinks before bed, staying active, and even a simple trick called double voiding. These are powerful things you can start doing yourself, like tonight.
Now, when you do need medication for BPH, there are basically two different strategies. Alpha blockers get to work fast. They just relax the muscles down there to make things flow better. Then you have 5-alpha reductase inhibitors. These work much more slowly, but they actually shrink the prostate gland itself over a few months. Two very different approaches.
All right, on to our final signal. This one is definitely the most visible of all, and it is surrounded by so many myths: hair loss.
The fancy scientific name for it is androgenetic alopecia, but you and I just call it male pattern baldness. It is by far the most common type, and it's really driven by just two things: your genes and your hormones.
specifically a really powerful byproduct of testosterone.
When it comes to fighting back, there are two main FDA-approved battlefronts. First up is minoxidil. That's the over-the-counter foam or liquid you put right on your scalp to help increase blood flow. The second is finasteride, which is a prescription pill that goes right after the hormonal cause, stopping that follicle shrinkage at the source.
Okay, now here's where things get really fascinating. This is where you can see just how connected everything we've talked about really is. For treating hair loss, the standard dose of that pill, finasteride, is this, just 1 milligram. But remember BPH, that enlarged prostate we were just talking about? To treat that, doctors prescribe the exact same medication, but at this dose, 5 milligrams. That's 5 times the amount. It's a perfect example of how one single drug can tackle two completely different issues, all depending on the dose.
So, after looking at ED, the prostate, and hair loss, what's the big idea here? What's the common thread that really ties all of this together?
The most powerful takeaway from all of this is that these are not separate problems. They're not isolated incidents happening in a vacuum. They are all linked by your body's most fundamental systems, your hormones, your circulation, and yeah, the natural process of aging. And managing one of them often has a positive effect on the others.
This whole explainer has been about empowering you through understanding. So please, remember, if you're dealing with any of this, you are so not alone. Lifestyle changes are your first line of defense, but there are absolutely effective, safe treatments out there. The single most important step you can take is just starting the conversation with a doctor or pharmacist you trust.
Because ultimately, being proactive about your health isn't about waiting for things to break. It's about listening. Your body is sending you signals every single day. The real question is, are you ready to tune in and listen?